If you're on antidepressants and you would like to get off and do it naturally, Dr. Lee in Living Well this month has the answers, and she's doing it with functional medicine.
Do you want to get off your antidepressants safely and naturally? Well, I'm Dr. Kristen Lee, and on this month's segment of Living Well, we're going to talk about just that. Functional medicine is when we look at the root cause of what is going on in the body. So if we take the example of depression for today's show, what we're really looking at is what the root cause of depression is. We live in a culture where there's a lot of preconceived notion of what depression is. For some people, that is very severe and they can't get out of bed in the mornings. For others, it's just a loss of joy or excitement in their everyday routine, or they're just not feeling like themselves. And what's important to really understand or investigate is that you don't feel like yourself. A lot of people don't realize that there's many causes to depression. Sometimes it can be something as simple as a low-functioning thyroid, a depressed adrenal gland, or even a GI issue. Did you know that 99% of serotonin, which is the main component of the majority of our pharmaceutical antidepressants, is produced by the gut? If you don't have a healthy gut, you can't necessarily have a stable mood. So a lot of times here at Metairie Health Center, we're looking at a functional approach to treating the depression to make sure none of those things are imbalanced. Now, of course, there are those cases where depression can be a chemical imbalance. And when that's the case, we recruit resources like Dr. Beth Ballin, who is a holistic psychiatrist that works here at Metairie Health Center. And she uses not only a pharmaceutical approach to treating depression, but she also uses supplementation and nutraceuticals to help aid in this support system. It can be very beneficial for you to consider coming off of your antidepressants, not only from a physical standpoint, but from a spiritual standpoint as well. Antidepressants can cause several issues, one of which being covering up an underlying issue that may have not been resolved yet. Two, it may not be working as well as you'd like to, and it may be inhibiting you from either further discussing this with somebody that's a specialist, or it also may be inhibiting your weight loss, which is a huge side effect to most of our antidepressants. Here at Metairie Health Center, one of the great aspects of using functional medicine is the fact that we use different key people to treat somebody's individual root problem. For example, our psychiatrist here on staff, Dr. Beth Ballin, who uses a holistic approach to not only treat our patients that are currently on antidepressants, but works with them to aim on getting them off. We have nutritional therapists here, metabolic coordinators, and other practitioners that are all designed to help identify the root cause of your problem and the fastest, easiest, and most effective way to get you back to your natural health.
I had absolutely no energy. My body hurt all the time. I was extremely fatigued. It was an effort to get out of bed, to get dressed, to try and think about what I was going to do, or if to do anything was almost impossible. I had to psych myself up to function. We worked on that. We worked on getting things clean, rebuilding the health of my digestive system, and that's going to take a while. But my God, the difference is night and day. My energy level is much higher. My body is working better. My digestive system is working much better. I'm not in chronic pain in my abdominal region anymore. My depression is so much better, and my blood sugars are phenomenal.
This month, for American Woman television viewers only, Dr. Lee is offering a free consultation with her to see if she can help get your health back on track. That's worth $245 for free. Plus, if you qualify for treatment, you can get a free training session with a personal trainer. Just give them a call at 303-974-1090. Again, that number, 303-974-1090.